Hello friends, we have learned about the indications of T-tube cholangiogram. When do you do T-tube cholangiogram and their indications? Now let us learn about the technique of T-tube cholangiogram. For T-tube cholangiogram, there is no need of any patient preparation is not needed. Then, second, it is done in a fluoroscopy unit with an image intensifier, number one, and we also need a tilting table. We can't do it in a normal table. We need a tilting table, and this is done 7 to 10 days after the surgery. Number one, or it can also be done earlier whenever if the patient suffers from either hemorrhage from the T tube or if there is no drainage from T tube. If there is either hemorrhage or no drainage from T tube, in both these cases it can be done earlier, or else we will have to do it 7 to 10 days after the surgery. So in this, normally the patient is put in supine position, okay, on the X-ray table. Number one, supine position, and the left side is raised a little. He is put in supine position and left side is raised a little. All the dressings, or if there is any metal objects which are present, they are metal objects, if they are present in any part of liver area, then these should be removed. Okay, next. Then after this, first and foremost, you will have to take a scout image, or which is also a preliminary film. That is the first film which is taken. A scout image is obtained. Okay, the main reason or main why should we obtain this scout image? This scout image is mainly obtained if to make sure that the position of tube is normal for the position of the tube, and to identify if there are any unusual collections, if there is any unusual air collections. So for this we will have to do a scout image or preliminary film is given. It's first you will have to take a scout or preliminary film. Next, you will have to take a syringe, and this syringe is connected to a 21 or 23 number, this is the number 21, 23 are number of needle. You will have to take a scalp vein needle, and to this scalp vein needle you will connect the syringe, and in the syringe you will filled with contrast material. Okay, this is filled with contrast material, number one. Okay, to make sure while you are filling the syringe with contrast material, make sure that there are no air bubbles, because if there are air bubbles, why? Because if there are air bubbles, these will mimic caliculi. Because they mimic caliculi, in the study we will make sure that there are no air bubbles. Then you will have to puncture the T tube. You can either puncture the T tube, or you can attach this needle to the end of this syringe to the end of the T tube. Either way it is okay. Then after attaching to the T tube, you will have to gently aspirate the fluid from the T tube to withdraw the bubbles. To prevent the bubbles, you will have to aspirate. Okay, then you will have to inject the contrast. Okay, now if you see about the contrast, okay, the contrast which is used here the contrast which is used here is actually a diluted contrast is used. Why? Because to make sure stones are visualized. Because if you use stones are not obscured, or they are visualized. Because if you use some not diluted, like the concentrated contrast, then the contrast can also be visualized as stones itself. Like the opacity of stones and the contrast will become equal, and we cannot differentiate between the stones and the contrast. So as a result, we should make sure that the contrast is dilated. Next, if you see that the bile ducts are distended. So if you see that the bile ducts are distended, then you can add more dilute contrast medium can be added. So if bile ducts are distended, you will have to add more dilute contrast medium is injected. Okay, but never, one important thing is never over distend it. Next. Next, you will have to take films while doing the procedure. So approximately 5 cc of contrast medium is injected. First and foremost, you will have to inject 5 cc of contrast medium. Okay. And then you will have to take a spot film in AP view. That is anterior posterior projection. You will have to take a spot film. Okay. Then this is first film. Then rotate the patient. After taking spot film, rotate the patient into left oblique position. Left, you will have to take left posterior oblique position. Rotate the patient into left posterior oblique position and then repeat the procedure. That is, repeat 5 cc of contrast medium. Okay, rotate the patient into left posterior oblique position and repeat 5 cc of contrast injection. Okay, this is one. Next, you will have to again place the patient in right posterior oblique. So, and then you will again inject 5 cc of injection, and finally keep the patient in supine, and then in the supine view take an X-ray, take a film. So the thing is, first the patient is in supine position and you have given the contrast. Next, rotate the patient to left posterior oblique like this. If this is the liver, left posterior oblique, you have rotated the patient, and then you have injected 5 cc of contrast. Then again rotate the patient to the right posterior oblique like this, and then inject 5 cc again. Then keep the patient in supine position and then take the film. This is how you take the film. You have taken, this is the second film. So this is the second. So this is the second film which is taken. Then normally 20 to 25 cc of contrast medium is given for special views. Contrast media are given for these special views. We have to take that is special views. Sorry, one more important thing. After you have rotated the patient to left oblique position, repeat 5 cc of contrast injection, and then again take a film here. So film is taken in left posterior oblique. Similarly, place the patient in right posterior oblique, inject 5 cc and again take film here. And here film is taken in right posterior oblique. This is the third film. And again keep the patient in supine position and then take a film again. Now, after this, you will have to, this is the final injection. This one here. And supine here also you can inject 5 cc of injection and you can take the film. Okay. Now, after this final injection, you will have to take a, this is the fifth film which is taken, which is right lateral film is obtained if required. Okay, next. If you want, you can also take films. Films are also taken at 15 minutes or 30 minutes interval also if required, based on the degree of delay in emptying. In order to know the degree of delay, based on the degree of delay in emptying, we can also take the films at 15 minutes and 30 minutes also. Then, next. One more important thing is, if you find any obstruction, okay, if obstruction is noted, then you will have to withdraw the contrast media, because if there is obstruction, then the contrast media, even if you increase or inject more, then it will be a problem. So as a result, one important thing is, if there is obstruction, withdraw the contrast medium as soon as possible, prior to, as much as possible before removal of syringe. Before you remove the syringe and remove everything, it is better to withdraw contrast medium and then remove the syringe. Next. Whenever you do a slow injection, okay, in slow injection, the patient should not have any pain. Sometimes patient can have a sense of fullness also. If there is marked discomfort, if in any case, if the patient has any type of marked discomfort, then if there is marked discomfort, then either a T-tube may be malpositioned, that is number one. If there is marked discomfort, you can say that T-tube may be malpositioned or there is obstruction. If the patient has marked discomfort, there are only two reasons. One, T-tube may be malpositioned, it is not at the normal position, normal side where it should be, or there is some obstruction. So in these cases, it is better to stop the procedure and then do the, and then evaluate the films which are already taken, and based on that take the decision whether you have to continue it or you should not continue it. Okay, so this is about the mechanism or method of in T-tube cholangiogram. Thank you.